Hello, today I would like to share about a kind of eczema which is called xerosis or eczema craquele or Asteatotic eczema. This kind of eczema is very common and we see a lot of this kind of eczema happen on young patients who has very dry environment or using harsh chemicals to take bath, for example soap, detergent, and then elderlies, especially when the skin is getting thinner and drier, and then they get this kind of eczema. And then we see a lot of patients with hypothyroidism and taking other medications like diuretics and tretinoins. Anything that makes the skin dry, they can develop this kind of eczema. This kind of eczema normally happens at the shins area, but it can happen at anywhere at the body due to the fact that it is caused by the genetic predispositions of damage of the skin barrier or the damage of the skin barrier caused by the environmental factors. I got a lot of inquiry about this kind of eczema. Today I had an inquiry from my cousin. She sent me a photo. So it's a very typical kind of Asteatotic eczema. Asteatotic eczema, it's very typical. It's like a cracked desert surface. It's you can see it's like a net like kind of patterns, so you won't miss it. Okay, sometimes it may inflame, so when you get inflammation we have to put a mild steroid on, but normally it's okay, just dry and crack, but it will not respond to normal moisturizer that you find in the market, which a lot of patients, if you have this problem, you may have tried a lot of moisturizer in the market, from the very oily one to the mild one or anything, but the only trick that I can show you which you can get rid of this kind of pattern is using collagen, topical collagen and oral collagen at the same time, and it has to be type 1 and 3 collagen. Oral one you can type the fish collagen, but the topical one which I found which is most useful is the animal-based collagen. On top of it, that you can use some moisturizer, the good one, but preferably oil-based, due to the fact that it can shield the surface of the barrier, which prevent the water loss. I had another case which is a kid, a very young kid, I think only 3 to 4 years old, that suffer from this condition, and that's a kid with xerosis. So it is a kind of genetic disease that has affected the kids, unfortunately, and a lot of people, they lost weight suddenly due to different reasons. Maybe they want to lose weight, just purposely lose their weight, or due to cancer, so they may experience this kind of phenomenon. Another one is nutrients deficiency, like zinc and some sort of fatty acid deficiency. So in this case, we also need to add fish oil, good quality fish oil in a big dose, or grapeseed oil. Bear in mind, it's grapeseed oil, it's not grapeseed extract, that we can actually add it to the treatment to speed up and then to improve the healing process. Here is a testimony from one of our patients. We have many of these patients, just I've chosen one of them, that you can see the improvements within 7 days. So actually with this kind of treatment, when I do the workshop training for pharmacists and doctors, and I will tell them this is the easiest eczema to deal with, and if you get this kind of patient, oh, congratulations, no, it's an easy job. It's easy to deal with. All right, thanks. This is a very short video for this week. I hope next week we can talk about other skin diseases or probably other things. I'm thinking of something to do with children, but you may suggest the conditions that you would like to understand more. Then we can share some testimonies with you so that you can actually follow the treatments if you want. Otherwise, you may consider it as a reference and combined with your local dermatologist treatment that might help you to achieve a very good result. However, I'm living in Malaysia. The drugs and products I got from here, so I don't know which country you're from. I hope you can get the same treatments also at your country. Thank you. Bye.